In the field of clinical psychology, conducting interviews and observations are fundamental techniques used by professionals to gather valuable information about individuals' thoughts, behaviors, and emotions. These methods serve as crucial tools in assessing and diagnosing various psychological disorders, understanding human behavior, and formulating effective treatment plans. Interviews and observations play a pivotal role in clinical psychology as they provide clinicians first-hand insights into the lives and experiences of their clients. By engaging in direct communication and observation, psychologists can gather comprehensive data that aids in accurate assessment and intervention. Interviews in clinical psychology encompass a variety of approaches tailored to suit different purposes and populations. They can range from structured interviews with predetermined questions to more flexible, open-ended conversations aimed at exploring clients' experiences in depth. Diagnostic interviews used to assess and diagnose psychological disorders based on standardized criteria. Therapeutic interviews focus on building rapport, establishing goals, and facilitating the therapeutic process. Research interviews conducted for the purpose of gathering data for research studies. Interviews follow a predetermined set of questions, ensuring consistency and reliability in data collection. In contrast, unstructured interviews allow for more spontaneous and open-ended dialogue, allowing clinicians to explore topics more freely. Effective interviewing involves employing various techniques to establish rapport, gather relevant information, and facilitate meaningful dialogue. Active listening. Active listening involves attentively focusing on what the client is saying, paraphrasing their statements, and demonstrating empathy to foster trust and understanding. Open-ended questions. Using open-ended questions encourages clients to express themselves freely, providing clinicians with deeper insights into their thoughts, feelings, and experiences. Empathy and rapport building. Demonstrating empathy and building rapport are essential aspects of effective interviewing, creating a supportive and non-judgmental environment for clients to share their concern. Observation complements the interview process by allowing clinicians to observe clients' behavior in naturalistic settings. This method provides valuable information about clients' interactions, habits, and patterns of behavior. Types of observations. Naturalistic observation involves observing individuals in their natural environment without interference, allowing psychologists to gain insight into their everyday behaviors and interactions. Controlled observation occurs in controlled environments where variables can be manipulated, allowing psychologists to study specific behaviors under controlled conditions. Differences between interview and observation. While interviews focus on verbal communication and self-reporting, observations provide direct insight into observable behaviors and interactions. Both methods offer unique advantages and are often used in conjunction to gather comprehensive data. Integration of interview and observation in clinical practice. Integrating interviews and observations allow clinicians to obtain a holistic understanding of clients' psychological functioning, leading to more accurate assessments and tailored interventions. Ethical considerations in interview and observation. Ethical considerations such as confidentiality, informed consent, and cultural sensitivity are paramount when conducting interviews and observations to ensure the well-being and rights of clients are upheld. Challenges faced in interview and observation. Challenges in interview and observation include maintaining objectivity, addressing bias, and navigating complex interpersonal dynamics while preserving the integrity of data collection. Case studies illustrating the use of interview and observation. Case studies provide real-world examples of how interviews and observations are utilized in clinical practice to assess, diagnose, and treat psychological disorders. Future directions and innovations in interview and observation. Advancements in technology and methodology are continually shaping the landscape of interview and observation techniques, offering new opportunities for research and clinical practice. Conclusion: interviews and observations are indispensable tools in the arsenal of clinical psychologists, enabling them to delve deep into the complexities of human behavior, understand clients' unique experiences, and provide effective interventions. By combining these methods judiciously and ethically, psychologists can make meaningful contributions to the well being of individuals and communities. Clinical psychology delves deep into understanding, diagnosing, and treating mental health conditions. At the heart of this discipline lies a crucial tool known as a Diagnostic and Statistical Manual of Mental Disorders (DSM). This comprehensive guide serves as a cornerstone for mental health professionals worldwide, providing a standardized framework for identifying and classifying mental health disorders. At its core, the DSM serves as a vital resource that aids clinicians in diagnosing various mental health conditions. Originally developed to bring consistency and reliability to psychiatric diagnosis, it has evolved significantly since its inception. The DSM not only assists in identifying disorders, but also plays a pivotal role in treatment planning and research endeavors within the field of clinical psychology. The DSM is meticulously structured, with each disorder outlined according to specific diagnostic criteria. These criteria encompass various aspects of an individual's thoughts, feelings, and behaviors, providing clinicians with a comprehensive framework for assessment. Moreover, the manual employs a categorical classification system, categorizing disorders into distinct groups for clarity and ease of reference. Since its initial publication, the DSM has undergone several revisions, each reflecting advancements in our understanding of mental health. From DSM 1 to the latest edition, DSM 5, significant changes have occurred, ranging from the inclusion of new disorders to the refinement of existing diagnostic criteria. These updates not only reflect evolving clinical knowledge, but also strive to enhance diagnostic accuracy and utility. Despite its widespread use, the DSM has faced criticism from various quarters within the mental health community. One prevalent critique revolves around the potential for overdiagnosis, whereby novel variations in behavior are pathologized. Additionally, cultural and social biases inherent in the manual have been scrutinized, highlighting the need for greater cultural sensitivity in diagnostic practices. Looking ahead, the future of the DSM remains dynamic, with ongoing discussion surrounding its role and utility in clinical practice. There is a growing emphasis on adapting dimensional approaches to diagnosis, which account for the diverse and nuanced nature of mental health conditions. Furthermore, efforts to integrate findings from neuroscience and genetics hold promise for enhancing our understanding of mental disorders and refining diagnostic practices. In conclusion, the Diagnostic and Statistical Manual of Mental Disorders stands as a cornerstone in the field of clinical psychology, providing clinicians with a standardized framework for diagnosing and classifying mental health conditions. While subject to criticism and debate, its evolution reflects the ever changing landscape of mental health research and practice.